Our lungs are precious. We breathe up to 16 breaths a minute, each breath filling our bodies with life. 16 breaths a minute. That's over 600 million in a lifetime. But they can be easily harmed. Over 500,000 South African bodies are infected with tuberculosis, a chronic disease of the lungs. Grahamstown, governed by Makana Municipality, has a population of over 100,000 people. The city is widely known for its educational edge and is home to Rhodes University and a number of reputable schools. But even in 2013, this so-called City of Saints is yet to overcome the legacy of apartheid. The unemployment rate is over 70%, and a large number of Grahamstown's residents live in poor areas. It is here that people have been hardest hit by tuberculosis, and 3/4 of those with the disease are also infected with HIV. People living with TB here have access to a few clinics, but the city is facing a critical shortage of highly skilled TB specialists. The nearest hospitals that are fully equipped to address severe cases of TB are located in Port Elizabeth, East London, and Port Alfred. These distances place an even greater burden on those seeking treatment. Grahamstown local government and hospitals have been accused of not trying their level best in ensuring that TB treatment is done as efficiently as possible. The implications of these issues have detrimental effects for both TB patients and their caregivers.
TB's always been a huge problem, especially in the Eastern Cape, for reasons unknown, probably because of a lot of migrant sort of labour, and also because of the rural sort of areas that we have. And the poverty, and also very interesting that the Eastern Cape has a very different strain of TB. And in the last 3 years, MDR TB has become a huge problem. And with that problem, multiplying daily, the hospital facilities can't cope, and they've asked NGOs such as hospice to come on board because we specialise in home-based care. So we've been asked to pick up the MDR patients, and in 3 years the numbers have grown substantially.
Health facilities such as Settlers Day Clinic are not receiving enough funding to tackle these issues head on. Staff turnover, a lack of thorough training for caregivers, and a social stigma attached to TB and HIV are some of the problems that make their work more challenging.
We need more. The people who are helping us, according to the programs, is HIV, because HIV is being funded, but TB is not yet funded. So we are getting struggle about that. If we've got those things of the TB days, for example, we've got to go out, like to the big supermarkets like Checkers, Pick and Pay, for donations to do these things. I need that. That is a gap we must close.
Our research into TB funding in the Eastern Cape for the upcoming year supported Sister Gojela's concerns about funding disparities between HIV/AIDS and tuberculosis. TB receives about a third of funding allocated to HIV. This disparity can be seen as reasonable, given that HIV infection rates are much higher. This means that the TB crisis has received substantially less financial attention, even though it is the leading cause of death. Development plans for the next financial year suggest that Makana's health facilities are not a top priority. Facilities in Port Elizabeth have recently received upgrades, while TB patients in Grahamstown still have to travel long distances to access treatment.
I don't want to be bad-mouthing Department of Health, but that is where it's. I walk in to visit my patients at the MDR TB facilities. At 12 o'clock, their medicine's still sitting on the bedside table. Nobody's taken it. You know, it's not meant to be like that. It should be very strict regimental treatment. Your sputums need to be taken every month. In fact, they're meant to be taken before you change the medication to make sure that the sputums are negative. Often that's not done, and patients are just put onto the next phase of the intensive phase of the medicine.
And in terms of patient transport, has there been no communication between Temba Hospital here and hospitals in PE to kind of sort out the doctors coming to this area?
There's no posts available and there's no funding to pay the doctors. So there's one doctor at each TB facility, and they're swamped with work, and they haven't got time to do outreach programs. But they should be implementing doctors to do the reviews where the patients live. The doctor should be coming to the area where the patients are, not the patients trying to find transport.
The Gene Expert machine is a device used to test for TB sputums. Trish Gillies alleges that the algorithm used to run the device has been incorrect for months, and the Department of Health has not responded to a call to change it. After having contacted Settlers Hospital for a comment, a lab technician who had committed to an interview chose to withdraw his commitment for fear of his job.
The Western Cape's got it right to reprint and send out a memo. Eastern Cape's still battling and still doing the wrong sort of. There's no clarity on, do we send one, do we send two, how do you put the labels on, and of course it costs 100 Rand for every sputum to be tested, and all those sputums have just been wasted.
Even amongst these structural issues, it is ultimately the patient that bears the brunt. Costing approximately 16,000 Rand in total, a multi-drug resistant patient has to take over 1,500 pills in 2 months. XDR patient Nandi Mandla is an example of a person that has become deaf from TB medication and claims to have been mistreated in a state hospital. Due to stigma, we have changed her name and her face is not shown.
Honestly, to tell you the truth, in state hospitals, we don't get the care that we should get. There is no care. It's only a few of them that would pay attention to you. You are just being told, this is what you've got to do. No questions asked. You just got to do it. So we are lost. We don't know what is going on. In Port Alfred, while I was there, you could not read what is written about you in your own file. That's the kind of treatment that we are getting as patients. You will never know what's going on with you. And when you pose a question, they will take you as a troublemaker. You shouldn't ask questions. I mean, can you imagine not knowing what's going on? You can't read your own file.
Hello? Miss Mtoba? Hello? And she's cut the phone. Hello, Miss Mtoba. My name is Vimba Midzi, and I'm calling from Rhodes University. We had spoken to Rose Somgezi, one of your colleagues, and we wanted to do a documentary on TB treatment in Grahamstown, and we wanted to hear or have an interview with somebody from the Department of Health. So we were wondering if we could have your permission for Rose Somgezi.
This mailbox is full and cannot accept any more messages at this time. Goodbye.
Accessing information about a topic as crucial as TB treatment has proved to be extremely difficult. If journalists and reputable organizations cannot access this information, there is very little chance that those with a lack of adequate resources will have any success.
We have managed to develop relationships at the department, at the Eastern Cape Department of Health, and so that makes it easier to speak to people or find out who we can speak to when we need information on certain things. It's not always the case that we will also get information. It just depends on, I guess, who is helping you. People approach departments all the time, whether they're students or whether they're organizations, because they need information on certain areas of, whatever areas that they need the information for. And the information should be available unless there's a really, really good reason why it cannot be made available to you. And that should be explained.
There
The Promotion of Access to Information Act enables citizens to access information from public and private bodies. The process is lengthy and complex, and therefore inaccessible for people with a lack of resources.
It's very sad, because I thought that when you're hospitalized, you're there to get help. They are put in those positions to help people. But to me, it seems like they're just there, to do whatever task that is given to them, finish, that's it. How they do it, whenever they do it, doesn't matter to them.